Welcome to the Bridge to Better Healthcare, uniting medical and pharmacy services on one platform to achieve value-based care. We have our co-founder and CEO here at Capital RX, AJ Loiacono, with us, and our Chief Innovation and Medical Officer, Dr. Sunil Budhrani. They're going to lead the discussion. I'm going to turn it over to them very quickly here. Just a couple of housekeeping items. First, we love answering your questions. Don't be shy. Throw them in that little Q&A box at the bottom of the screen. If we can't get to them in real time, we'll definitely get to them at the end. And if we can't answer them because of the hard stop, we'll make sure to follow up. There are slides. We're going to run through those. We'll make them available along with the replay. For those of you that have joined us before, that goes up on our CapRx Insights page pretty quickly. We'll also send out an email afterward. And let's see here. I think that's about it. So we'll probably push some highlights out on LinkedIn too. So if you're not following us there, please do. And thanks for bearing with me on all that. AJ and Sunil, thanks for taking the time today to discuss what's going on. I'm just going to give the floor to you, AJ. Kick it off.
Great. It's great to be joined with Sunil. Good to see you, Doctor. Hope you're enjoying your afternoon. We're just going to do some quick intros and get right into it because we want to make use of our time. AJ Loiacono, CEO, been in industry for over 25 years, about a third in pharmaceutical manufacturing, two-thirds on the payer health plan side. So I'll turn it over to Sunil.
Great. Looking forward to this discussion, AJ. Sunil Budhrani, I'm the Chief Innovation and Medical Officer here at Capital RX. Been with the organization about 3 years. Time flies fast when you're having fun. Kind of divide my career in thirds. First third was primarily in the provider space. I'm a practicing board-certified emergency room physician, and believe it or not, have continued that role after all these years, and kind of spent the second half in the digital health space, specifically telehealth, and then finally spent several years in the health plan space with one of the big three. So I always say CapRx is a convergence of many ways in my career of learning how to make things better.
Great. Well, let's get right into it. And we're really excited, to go through this topic, but it's always good to just kind of ground people in what we do here at Capital RX. So many people on this call may know us as Capital RX, the full service pharmacy benefit manager, a PBM. We also have another division of our company, which is called Judi Health. And this is licensing, technology, and services. And we call this a health benefit manager, HBM, because it is both medical and pharmacy services combined on the same platform. Next slide. So the other thing we want to ground on is, the scale in which the company operates. We often say we are the fastest growing health technology company in the United States over 5 and 7 years. That's measured by both gross revenue as well as lives managed. And so on the employer member side, we're well over 4 million member lives that we service directly, and that's full service pharmacy benefit manager. And then on the other side of the house, in the Judi Health side, we have 54 million members that rely upon our technology and services. And over this we're at 7.5 year marker for the company. We've emerged as a national brand. We've been the recipient of lots of awards and patents. We're operating at incredible scale. We service over 350 large payers. We have over 1,000 employees. But the markers of success are call center sat, industry leading 87 net promoter score, and that's delivered in a 24/7, 365 domestic call center group. In addition, our client services, 85 across both health plan and employer with a 99% retention rate. And also these logos at the bottom, this is our dedication because we process both government and commercial claims. And to do that, we have to operate at the highest level of certification. So it's not just SOC 1, SOC 2, NIST 853, but also HITRUST, FSMA, FedRAMP, and also on the clinical side, NCQA and URAC. Next slide. One of the things that we want to talk about is how did we come to this point where we started to think about how can we move beyond just pharmacy. And I created this spaghetti chart on the left for my board of directors probably 5 years ago. And the way I want you to visualize this is that middle line, it says plan sponsor. That could be an employer group, that could be a union, a municipality, that could be a health plan, that could be the federal government. It really doesn't matter. What does matter in the United States is the moment you have a prescription, it goes along that top line and it goes on its own separate journey and touches all these different vendors. And the moment you have a prescription claim, it goes on a separate system, a separate transport, if you will, and touches all these additional vendors as well. And not only is it you're doing everything twice, I often say if you do something twice, it's at least twice as expensive, but more importantly, it's this patchwork of tertiary and secondary vendors and this disparate, antiquated system that not only is preventing the realization of value-based care and contracting or any innovative reimbursement contracting, but also it's creating what we call gaps in care through gaps in data. And that when you move from system A to system B in healthcare, the data is already wrong because healthcare never stops. Claims are paid, claims are reversed, things are coded, things are recoded, people are eligible and ineligible. And then it moves from vendor B to C to D, and it gets back to A. And claims are really never correct in the United States when you have this fragmented patchwork. And so our job, we felt at Capital RX and at Judi Health, was to replace this patchwork with unified claim processing. And I always want to point this out. This has never been done in this country. There has never been one system that can process medical claims and pharmacy on the same platform. And the only one that can is Judi Health. And we launched this at the start of this year, and Sunil's going to go into the amazing results we've had. Next slide, please. Sunil, this is all you.
Yeah. So I always say that a goal of a health technology or a platform or a workflow should be to empower and strengthen the relationship between a patient and their provider, their clinician. The traditional health benefit model doesn't support that. It's not because it's not trying, but fundamentally and infrastructure-wise, it's broken. You all know, whether it's directly as a provider or a patient or a family member or a loved one, when you encounter the healthcare system, you're lost in the silos of care: vision, medical, pharmacy, dental. They all live in different worlds. Health plans, PBMs, also kind of in the middle, but not bringing these pieces together in the way that needs to happen and taking care of the patient the way it needs to be done. The systems are disjointed. There's duplicate work that's happening across all these different areas. We're repeating processes for medical and pharmacy every single day in separate islands. This creates slower resolution times, patient friction, provider friction, late payments, delay in care. When you have significant diseases like cancer and heart disease and so on, these infrastructure problems, these broken silos, create significant problems and result in poor quality care at higher cost. There's no real-time visibility or very little in patient activity outside of the hospital. And we create more mistakes and more problems as a result of these disjointed systems. Transparency is a word right now that we're using all the time in healthcare because of the lack of. The legacy systems are being challenged because people don't have visibility in their healthcare needs. I always say, if we buy a pair of shoes or we're buying some article of clothing, we know exactly the cost. We can shop for that. We have no visibility or transparency into the model until now with Judi Health. Next slide, please. So our goal and focus, as AJ mentioned, was set out on a quest about 20 months ago to expand our successes when it comes to pharmacy. As many of you know, I always say our not so secret sauce here at Capital RX is our ability to create a platform for pharmacy that was a brand new de novo infrastructure to do end-to-end pharmacy transactions that make it efficient, modular, transparent, and create an opportunity, a marketplace for all users, patients, providers, pharmacies, employers, brokers, et cetera, to have visibility in what's happening to that pharmacy claim. But then we went on this journey 20 months ago to expand that pharmacy mission into medical, to create a single unified claims platform in the country as of January 1 that we use now in our own employee population, and that we're getting inquiries and doing demos now with a vast number of groups in the employer, health plan, TPA, you name it, space. This platform allows something that I've always said can happen in healthcare. You can get higher quality care at lower cost. We spend 20% of our GDP on healthcare. 1 out of 5 jobs are related to healthcare. It doesn't make sense when you sit at the middle or bottom tier when it comes to global healthcare delivery of people we take care of. Here you can drive down costs if you can bring these pieces together. You can unlock a total cost of care analytics that I'm going to share with you shortly in a way we have never done before. Typically, when we report out medical and pharmacy, it's two teams, it's two systems, it's two reporting structures. We reported for ourselves and for future clients a single reporting of medical and pharmacy that show the interaction between the two, because diabetes as a medical condition and the drugs relate to it are connected. They're not two different conversations. Cutting administrative overhead, improving rates like those that affect stop loss. Key things like managing eligibility, workflows, and analytics, and enabling a fast, efficient plan administration so we can remove the fat between the patient and doctor, make sure people get paid accurately and efficiently, but also patients understand where they need to go, how they need to get their care, and what transparently is their out-of-pocket cost for a particular procedure or a test or a drug. So we're creating a single source of truth to unify all these platforms and creating a single view for all users who we're going to talk about a little later for them to access. Next slide, please. So what does this mean? Why are we doing this? Why is this so important? As I said before, there's a number of reasons why we need to do this, but the heart of the reason in my mind as a practicing doc is take away the friction between me and my patients. And the only way, as much as mission oriented as we can do that, and we can do that in a bubble, unless we bring the whole ecosystem of healthcare, it's not going to happen. And what is that ecosystem? From the time a member, a patient, an employee, let's think about this for a second. 50% of people get their healthcare through their employer. Another 20% get it through Medicaid. Another 16, 70% get it through a Medicare. These are the ways people are getting their healthcare. If we think about the vast majority are getting it through their employers, there's a process involved. There's verifying and making sure that member is eligible for that if they're an employee in a company. There's the plan design that the employers have to put together that makes sense, that they offer that employee. And then there's the payment of claims and the coordination of care between medical, dental, vision, and pharmacy. If we can bring all these pieces together in a single place, which is what we do with Judi Health, we can contain costs, we can give a higher level of reporting and analytics, care navigation. The problem in healthcare today is people just don't know where to go, and it makes it difficult. As an ER physician, I'm seeing patients show up there for not the right conditions, cough, colds, and so on. There are other channels. There are other opportunities for people to obtain care. They just don't know. And there are better opportunities at lower cost. So if we can bring all these pieces together in a single chassis, in a single infrastructure, where pay claims, eligibility, plan design, claim adjudication, and then provide navigation and administrative resources, we can finally talk about things that we've been talking about for 20 years in healthcare where there's been very little momentum, like value-based care. In order to do that, this is the chassis of the future that we can think about to get there.
Yeah, and I always want to point this out, Sunil, which is when we think about insurance in the United States or a funded benefit, self-insured or otherwise, we talk about the four pillars of insurance. We often talk about eligibility, the binary state if someone is in or out of a benefit plan, and that includes everything from enrollment, accumulators, data exchange. Then you move to the next section, which is plan design, which is both financial plan design as well as clinical plan design. And that includes obviously the benefit setup and the network configuration. And then you think about the adjudication of claims. And now this is spanning on one system, medical, dental, vision, and pharmacy. And then you think about the billing segment. It's not just payments, it's also thinking about who needs to be billed, who needs to be paid, et cetera. And this is to providers and pharmacy. But if you think about the middle layers, like between eligibility and plan design lives care navigation, between plan design and adjudication lives administration, between adjudication and payments lives cost containment or any other integrity component. And then obviously the bridge back to the beginning, which is reporting and analytics. But no one has ever thought about putting all of this on one system to avoid all of those gaps in eligibility, gaps in data exchange, accumulators, benefit design, the other claims that may support clinical workflows or innovative reimbursement models, all of this coming together. And I think this is a great way that this is visualized. If we can go to the next slide.
So,
this is back to you, Sunil.
Here's a question for you, the magic question. And I'm sure many of our audience have the similar question. It's like, who should be considering the Judi Health platform based on what we just shared?
Yeah, and I always say is people ask me all the time, do I have to like get all of these services from you? Can I get one of the services? And the answer is you could buy just one service. You can engage with us on one type of system with us. It's not a scenario where it's all or nothing. And so, who should be thinking about the future here? And obviously self-funded employers, and this isn't going to be for every self-funded employer, but self-funded employers that are innovative, looking for more control, looking for better data integration and reporting, and this could lead to better outcomes, better cost savings, trend management, et cetera. So I think first and foremost, the ASO market, self-funded employers, larger sides should absolutely be looking at one or more of these components as you start to bring it together. And I think in your case study, Sunil, you're going to demonstrate the value proposition there. The other side is payers. We license this technology today, to health plans and TPAs, so they should definitely be looking at this. And then I think lastly is brokers and consultants that work with self-funded employers. There's lots of tool sets here that can augment a broker or consultant's work with their client. And, that's across the board where, sometimes we work with brokers and consultants and, they may be obviously providing insights or services, but they don't quite have the tool sets or the control. And this certainly can give them a capability that no one else has. So I think these are the three key areas when we look at partnerships with us, beyond just being a pharmacy benefit manager, but when we look at what type of people would benefit from Judi Health and Unified Claim, it's these three main categories.
Yeah, and I think that's what makes this a very unique platform because it allows the employer TPA health plan or so on to be able to plug and play and choose what they need as a network, a care management solution, a mail order, and so on. And they can plug it in a chassis that allows them the visibility and flexibility to do so.
Yeah, yeah. Well, I think this is a great way to visualize this. For a lot of our customers, Capital RX is known as your pharmacy benefit manager, and we're servicing you. And, what I talk about is all of the other vendors we work with in what I call the administrative layer of a benefit. A lot of people, I ask them a question, what is a health plan? And they struggle with the answer. And I say it's very simple. A health plan or a healthcare company is your delegated representative to administrate a portion or all of your health benefits. I mean, that's the job, is to administrate all of these hundreds of functions in the background. So I look at all the other vendors that we partner with and work with today, or, some of them, as simple as just a data exchange. So we have, and I always want to make this clear, there's always a carrier with a network that is working with the customer. There's always point solutions out there that are providing incredible value for customers. But I'm talking about the administrative guts, the base layer of adjudication, data exchange, eligibility, file feeds. All of this is handled by multiple vendors. And this is a very simplified diagram, but it helps to people visualize. So on the pharmacy side, let's just say it's Capital RX. And the average payer, again, this could be employer, TPA, wherever's licensing stuff from us, there's a medical claim processing component. And many times it might be a third party used by a third party. There is a medical payments and printing vendor, and that could be a third party component. There's a Ben admin platform for both eligibility, enrollment, connectivity services. There's a navigation layer of medical and pharmacy. And today, these are all different vendors, and there's obviously gaps in time and data because when it's not on the same platform, and we talk about this quite a bit here at our organization, a single source of truth. This is the definition of an enterprise platform. An enterprise platform is a single source of truth that unifies all of the work streams. And this is so important because there's no longer a gap when you're on Judi Health. And I think this is something that everyone has talked about, but no one has been able to deliver, which is one system. You never have to worry about when were the accums sent over, who's handling the eligibility file, when were things paid, when were things reversed, did that impact the payment schedule, who's handling the enrollment eligibility, did they get the right information, and how do I navigate this in real time if I'm not operating on the back end in real time. And this is what I believe has been such a game changer and what we're so excited to talk about. And if you advance the slide, Sunil, you're going to take it from here on, how this suddenly impacts everything.
Yeah, and I agree because it's very disruptive for a traditional health plan model to bring all these pieces together. And that's why, frankly, you just don't see it done. In this model that we have deployed here at CapRx and also for our future clients, is we're bringing all these pieces together to demonstrate clearly that we can deliver high quality care at lower cost. In fact, we've delivered anywhere so far, very early data shows somewhere between 5 and 15% reduction in cost with absolutely no plan changes. In fact, only an enhanced plan offering that we gave to our employees in January 1. So as you can see from this wheel is our PBM, our benefit management solution is CapRx, which we have been with since we started. And of course, and then medical. We went live January 1 as Judi Health being our medical claims processing solution. We brought together the payments and printing component and similarly the benefits admin. And then finally, navigation, putting together the medical and pharmacy in the reporting way that I talked to you about. Now, one thing really important that I want to stress is we offered our employees a full service solution. We leased a provider network that we plugged into our adjudication systems. We provided a payment solution to make sure our providers were paid promptly. But because we built a flexible modular system, we are able to plug and play a provider network and tier them in a particular way that works for the employer or works for that TPA or health plan. So this is an important piece to digest. We are building a healthcare ecosystem around your choices, but the chassis is the Judi Health infrastructure to be able to deliver on that promise. That flexibility is what I believe makes us very unique. On the next slide. So the future of health benefits administration, we like to say, is now, meaning we're the only platform, as you heard us say, enabling employers to achieve true value-based care. Let me tell you what I mean about that, because that's a bold statement. We've been talking about value-based care for 20 years. I've been on a number of panels conversing about this, and the PBM industry has talked about it, the medical industry, hospitals. I've been through many of these conversations, but not until you can bring this all together can you really talk about an outcomes-based reimbursement, rewarding for keeping people healthy system. You've got to bring the pharmacy, medical, vision, dental, and the infrastructure chassis, like I showed you before, to be even able to make providers and clinicians in hospitals have trust that the data is accurate to be paid on outcomes. Many people will tell you in the industry, the reason why value-based care is not fully taken off is because the data is inaccurate, payments are inaccurate or not timely, and the systems are not constructed to promote a preventive system that is absolutely necessary as we go forward because of the cost of care rising. So standards of value-based care, we're talking about quality of care, provider performance, patient experience, and managing costs. I don't know how you can do that without having a single chassis that connects all the pieces that we have talked about thus far. So integrating claims of medical and pharmacy for a seamless experience, real-time data sharing. This is really important. I always said in the past that if you can bring all these systems together, claims, medical data, and so on, you can kind of do the trifecta of patient care. You can do real-time care management. You can do predictive analytics. 10, 15 years ago, if you had the right data, you could predict diabetes. So today, talking about artificial intelligence is something that I kind of chuckle at sometimes because you can only unlock that if the data is consolidated in one place. Reducing administrative burden and innovative pricing models. We haven't been able to experiment with plan design, network design, and many other areas because, again, the pieces are sitting in different rooms. So we're very excited about where this is going, and I'm going to show you some preliminary data to explain that. Next slide. AJ, this is, I believe, yours.
Great. One of the things that we want to talk about here, again, is when we started working on this project, we had been focusing quite a bit on the back end of what we call insurance, back to those 4 pillars of eligibility, plan design, adjudication, payments, etc. And we had created this very powerful layer in which there are no gaps in data or care. and we needed to marry it to the front end. And so one of the things that we started focusing on is this concept of Judi Care, which is take all of that data, all of that real-time information, and now deliver it in the hands of the patient and everyone that obviously supports that patient in the workflow. And so for us, one of the things that we focused very much on is, again, marrying the pharmacy and medical adjudication with the front end navigation. So all of your information in real time provided to the member. And this unlocks an enormous opportunity of not just the current value to the patient and the plan, but on a go forward basis where this becomes conversational care. This becomes guided AI navigation that you can layer in as well now, where, I often give the example, hey, I'm having back pain. And because I have universal views in real time, I could be like, hey, would you like to go see your primary care physician? Do you want me to schedule that for you? Oh, in addition, I saw that you saw a chiropractor. They're still in network. Would you like me to make that appointment again? Be like, oh, did you know that you have a pain management or care management point of sale solution available to you? Do you want to engage with, Hinge or Sword, whomever it may be in this example? And more importantly, at the end of, hey, the actual process where you, again, in real time can see the patient did go and see their primary care physician, be like, hey, did that help? Do you want to explore one of these additional options? All of this has been impossible to get to because you did not have one unified layer. And this gets me so excited is that the investment we've made both on the back end and now on the front end is really unlocking so many things that were originally like, hey, that's a wish list of things can come. And now it's just on the product roadmap for something that we're going to deliver next quarter. And that's extraordinarily exciting. And I look forward to future updates as we begin to have people see the power of unified adjudication. But let's move to the next slide.
So yes, I'm going to share with you the data that we've received from
Well,
our.
this is your case study, Sunil.
Yeah, I'm super excited about it, and I'm going to get to the data points in one
I don't know
second.
if you're muted or it's me.
I should be thumbs up, Justin. Good to go. So,
Oh, I hear you.
okay, perfect. So yeah, 'cause I'm glad you pointed out, guys. This is really important for me to share and be heard. So here's the thing. This data reflects something that AJ talked about that I want to double click on just for a second. Imagine a world if you're a TPA, self-funded employer, health plan, so on, the audience that we talked about earlier. There's been a tremendous amount of vertical integration that's happened in healthcare, which we're all aware of. And the intention of that vertical integration by the traditional health plans has been to deliver higher quality cost, integrated delivery of services, and deliver value by bringing all these pieces together. And the market has spoken that it's not necessarily working the way it needs to. And then there's the fully consolidated health systems and health plans that you may be familiar with, like the Kaiser models. What our focus has been is really create a virtual integration where AJ was talking about a world where we build a healthcare ecosystem around your patient population with that front door of Judi Care and then the back infrastructure of pharmacy, medical, etc., under the CapRx infrastructure. We intend to replicate that not only for our employee populations, for all those, and build out that for customers that are out there to create that world around themselves so they can pick and choose, as AJ mentioned, their own point solutions, their own network designs, their own plan designs. This is a very important kind of take home. We did that with our employee population this January, and our early results have demonstrated some really interesting findings. I caveat this by saying it's very early. Not many people do a self-assessment 6 months only into a plan to a rollout year. But I think it's worthy to take a look at this. So from 2024 to 2025, our population, our employee population has grown tremendously. That's a reflection of our incredible growth when it comes to our customer adoption and customer satisfaction and an excitement. But also it's because I believe, I always say what makes us amazing is our incredible technology and engineering teams and so on, and our customer service teams that are out there making sure everybody's taken care of every day. This growth, as you see from 2024 to 2025, has resulted in an RX, our pharmacy PPM, going up only 2%, which is a big deal when it comes to the RX spend that's happening these days when you are thinking about the face of GLP-1s and other expensive intrafusion treatments and the all the other things that have come over the last couple of years when it came to pharmacy has created much more gains when it comes to the expense when you talk about RX PPMs. But the medical PPMs rather been interesting to look at. Despite our significant growth, we've seen a reduction year over year when it comes to our medical PPM. We had a large national health plan ASO offering last year. That's our comparison. And we have been able to demonstrate about an 8% reduction in medical PEPM over the last period of time through April. Our total PEPM, if you look at it, is now dropped almost 5%. Now, this is early data, but I always say the cost of an employer's healthcare is their administrative cost, which is a smaller number. It's the total cost of care management that puts a lot of companies out of business. And so this is an area that we're very focused on when it comes to making sure Judi Health is delivering on the promise of not just giving higher quality care, because we give our employees a more robust telehealth, more robust women's health, more robust disease management solution than they've ever had before. But at the same time, we've lowered the overall cost of care because we built an ecosystem around them using Judi Health. So this is a very exciting piece. We're watching it very closely, and the integration of medical and pharmacy and its impact.
And I always want to point out, Sunil, these are hard dollar savings. This isn't like I have this really difficult formula to determine some reduction in perhaps some projected trend. This is taking the same plan design and looking at the PMPM and the hard costs that are coming out of it. And the other part of it is that's hiding in here is all of the administrative costs we ripped out. So third-party vendors that we did not have to pay in this process or add into this process. And so, these are very clear savings. And I think your next slide is going to drive home the most important point, which is the satisfaction.
Yep. So as many of you know, we have created our own bar when it comes to customer care here. Our NPS scores sit in the numbers that retail industries hold themselves to, not healthcare. NPS scores typically in healthcare are much lower. You're lucky if you hit a 50% mark in healthcare just because of, and it's not anybody's fault, the infrastructure doesn't support an efficient system, which indirectly leads to an NPS score typically low in healthcare. But we've had more than 1,200 inbound calls, a number of outbound calls, about 1,400 plus interactions, more than that now since this is April data. Our average speed of answer, less than 30 seconds. Average handle time, less than 10 minutes. And our NPS scores are tracking well above 95%. This is unheard of. Now, the why of how and the how we got here is very simple. The same successes, the same tools, and the same people that have been building out our pharmacy expertise and our pharmacy service and technology capabilities, we've not only unified our technology backbone, we've unified our services. If you're going to do this right, you've got to build the foundation correct. So our foundation was built on using the success we've had in the people in our organization to make sure they're servicing medical also. Imagine a meeting, as I said before, when we're not only reporting medical and pharmacy to you, but we're also having combined teams or the same people coming and talking to you about how the drug and the disease go together. So we're very excited about where this data is going. Most of the context of what you would expect from a customer service. It's coverage questions, eligibility questions, and we have a robust account management team that is supporting the needs of our members to make sure this goes seamlessly so that as we add on more groups, we are delivering the same highest quality care and a bar that we set for ourselves here with Judi Health. Next slide, please.
Well, and I think this kind of brings it all together for us, before we get into the Q&A, which is, over 7 years, most people in industry know us at that 11 o'clock spot of pharmacy benefit management. But, very quietly over the last 5 years of R&D and development, we've built a full-blown eligibility platform, data exchange, care navigation. Yes, pharmacy benefit management, and that is commercial care and Medicaid. but medical claim processing now, vision management, dental management, and payments all on one platform. And this is the beginning. I think this is going to become the industry standard. I think people are going to look back and be like, remember that time when we had a system for this, a system for that, a vendor for this, a vendor for that, and there's no reason. And I think the key here is once you have that data layer and that information layer operating seamlessly in real time, you could now observe and deploy so many interesting and unique, innovative, processes. I always say we are not the architects of what the future of healthcare is, but we are the architects of the future of the administrative layer of healthcare in this company. And I think again, this is Judi and a glimpse into the future and the industry standard. So we couldn't be more excited, but I always want to end on this point. Why did we build this platform? Why did we take on, this huge lift and undertaking? Well, if you advance this slide one more time for me here, it's very simple. We wanted to give any payer in this country the freedom to build any benefit plan any way they want. And this is what has been missing. There's always been like, oh, the fine print, I can't do that. I wish we could. And this goes to the mission of our company. We talk about the mission of our company, which is to give our country the infrastructure we need for the healthcare we deserve. And what we mean by that is everyone on this call could think of hundreds of brilliant ideas to improve healthcare, but good luck implementing any of them on our aging infrastructure. And so Judi and our Judi Health division now unlocks all of these possibilities and is becoming the future of care in this country. So we couldn't be more excited. With that, Sunil, any closing thoughts before we open it to Q&A?
I would just say that the only way to fix the healthcare system, I started this way, I'm going to end this way, this conversation is, I've seen the broken parts in the hospital, outside the hospital, and the digital health that's tried to solve for it. The only way is to gut it out and think about how to bring the broken pieces together in a way that reduces the friction between the patient and the provider. And this is the way that we feel is going to change the future of healthcare.
Nice.
All right, thank you, AJ and Sunil. That's great. Quickly, I'm going to try and get through as many of these questions as we have. Thank you, everyone, for lobbing them over the wall to us. First one up, how many medical vendors have you partnered with to use Judi for their customers? I think this is more on the technology side, AJ.
Yeah.
Somebody saw BCBS of Oklahoma share that Judi will be used. How many others?
Yeah, so our launch partner for our plan was Cigna. We're super excited, for the results in that partnership. In addition, we have going into next year, multiple, and I don't want to speak for these other carriers. I always want to say is my answer is multiple. I always want to point out is almost every national carrier or regional health plan works with dozens, sometimes hundreds of different TPAs and groups. So, this isn't necessarily a fight around network or data integration. It's really just giving the payer the choice that they need. So we haven't seen too much friction there. And if there is, I always go back to the plan sponsor and say, what do you want to do? We don't want to be an encumbrance. But I think this kind of plugs into the question right below it, which is I'm reading on my screen, which is, a lot of clients, this person is saying are extremely customized. They have custom file layouts, eligibility, prior data exchange. How do we work with PBMs, even if we're not the PBM? And our point is to say, we work with anyone. A data exchange is a data exchange at the end of the day. We hope that, and the modality and the cadence of that. So I was just in a meeting earlier today where someone's like, can I get real time, updates? The answer is sure. We're able to do it on our end. Is the counterparty willing to do it? And more importantly, if there, is a bridge that needs to be done on the implementation, we're willing to invest whatever that cost is to get it done, because that certainly shouldn't be the impediment there. And so we always want to point out more than anything else is, and I tried to reinforce this at the top, which is we don't need to be all of these things. We want to be the layer that integrates these things, or obviously in many cases, provides better visibility across the patient journey. And so again, is we're open to any conversation. And I think as we have expanded in pharmacy benefits, working with pretty much every carrier and provider and TPA in the country, it's the same here as well. And building on those relationships, it oftentimes might be the same data exchange group or just a different division in the same company.
And I guess a quick reinforcement there, those that folks that we work with, it's all lines of business, right? Medicare, Medicaid.
So today on the pharmacy benefit side, we do commercial care CAID, including ACA, ICHRA, fully insured, self-insured, et cetera. On the medical side, it is self-insured today, but for 1/1 of next year, it's expanding into government services. So Judi will be able to do medical care and CAID.
And Sunil, I think this is a good one. Does the medical claims history show up on the member portal like the pharmacy claims do? How are we displaying that?
Yes, it does. Absolutely. Because that's the power that AJ was talking about that you unlock when you put this all together. One thing I was also going to add, Justin, is when I was in the health plan world, and probably many people in the audience can relate to this. I used to often get asked, can we change our network design? Can we tier a certain network one way, tier 2 and tier 3? And because the systems would not allow it, it was just a general network that you had access to and that your employees would have access to. With an infrastructure like this, not only can you modify and choose your network design, so tier 1 could be a local major health system, a tier 2 could be this, and tier 3. Plan design. There's a lot of opportunity and a lot of requests for innovation in plan design. For instance, creating plan designs that support certain conditions. It could be endocrine conditions like diabetes, where you create a design that creates $0 copays to go see your primary care doctor, your endocrinologist, and $0 for insulin and metformin for the diabetes drugs. So you encourage people through plan design to seek the care they need. This is very simple stuff that most people in the health plan industry have always asked, wished, and know can solve a lot of problems, but the systems don't allow for that. This is what excites me about the Judi Health platform, that we give that flexibility, like AJ was mentioning, in infrastructure for you to create the world that's personalized to your employee population. Because we know demographics in populations vary dramatically, and one size doesn't fit all, and that flexibility is really key here.
Yeah,
Makes ton of
and
sense.
I was going to say to keep, driving through the different, questions that we have. I'm just looking at here, which is someone's having a call out to you saying hello, by the way, to you, Sunil, in the Q&A section. And I think that's a nice note for you to read later. But the other part of it is I saw a question in here about, do we work with state Medicaid organizations? And I always want to point out, we do not sponsor Medicaid programs. People that do administrate Medicaid programs use our technology in multiple states. So, we're the software layer and the administrative layer, but we do not sponsor today any Medicaid business directly.
And we do have a hard stop coming up, so there's a couple more I think I can get through real quick if you guys are good for another minute or two.
Yeah, I mean, I'm just picking some here, which is, does your transparency show the plan sponsor what the pharmacy was paid, and do you show the pharmacy how much the plan sponsor was charged, and show each what the administrative charge was? The answer is, in full transparency, when the claim adjudicates, it's going to have and I always want to be fair. If you're using Capital RX, our business model is these things match and marry. And so, we call it a, single ledger for a reason. And the reason is all of the information on the adjudicated claim file matches the 835 reimbursement file. And there's no variance between our customers. So everyone gets paid the same. Now, to be fair, someone who has like a fully insured benefit plan and they're using our technology, obviously, it's going to be their benefit, their relationship with their network, with their membership, with their payers, et cetera. So I always want to be very fair there, which is our job is to be the administrative layer, and to let the payer or the ultimate payer determine, what that plan or design may be. And I feel like this is lost sometimes on people, which is I always want to be fair is our goal is to provide the tools. How people use them is entirely up to them.
Just a
I've
quick
got
thing, the last two questions. Member portal can be white labeled. That's a offline discussion on what that looks like and so on. And then how do you deal with plan sponsor that has United Care and using Optum as their PBM? So using Optum and United, can you, and this is something we encounter all the time in this industry. AJ, you want to, I know you.
Yeah, I mean the answer is we don't care. I mean, I would say we care is delivering the best service and quality, but it doesn't matter to us if someone wants to use four different vendors and we have one service offering in this component, or we're the global administrative platform and they're using multiple different endpoint vendors. The thing that we're trying to make people understand is there's this new world that's emerging where there's no gaps in data, there's no gaps in information. And this plays very well in if you think about the future of care, which is, yes, the transparency that we're all acknowledging, but more importantly, how do you begin to cater to that patient's journey in real time and making those observations? And this leads to a deeper discussion. We're going to get into it. I'm assuming the follow-up to this on AI and how AI benefits from this unified claim layer better than anything. And I'm super excited about the progress there. So I just want to thank everybody. We've run out of time and we do have a hard stop today. But if you want to follow up, please follow up with the marketing and communication team or send us emails if you have our information directly. We're happy to have a conversation, but we just want to thank everybody for taking the time today.
Thank you all
Thank
so
you.
much.